In Part 1, we revealed how chronic poor sleep can silently increase your stroke risk, especially if you're over 60. Now, let's go deeper. Because one of the biggest dangers for older adults isn't just not sleeping well. It's not knowing why they're not sleeping well. Behind the curtain of those restless nights could be one of these 3 common but underdiagnosed sleep disorders, each one a hidden threat to your brain. Let's start with the most dangerous one of all. If you snore loudly, gasp for air during sleep, or wake up feeling more tired than when you went to bed, you might have sleep apnea. And if you're over 60, the chances are even higher. Sleep apnea is a condition where your airway becomes partially or completely blocked while you sleep, stopping your breathing for a few seconds or even minutes at a time. Every time this happens, your brain is starved of oxygen. Your heart has to work harder. Your blood pressure surges. Your sleep becomes shallow and fragmented. And over time, this repeated oxygen deprivation leads to inflammation, plaque buildup, and damage to your blood vessels, especially those in the brain. In fact, studies have found that untreated sleep apnea can increase stroke risk by up to 3 times. And yet, it's estimated that over 70% of older adults with sleep apnea don't even know they have it. Why? Because the symptoms are often subtle or mistaken for normal aging. Morning headaches, daytime fatigue, poor memory or brain fog, mood swings, waking up to urinate multiple times a night. If you or your partner have noticed loud snoring, pauses in breathing, or choking sounds during the night, please don't ignore it. Talk to your doctor. A simple home sleep study can detect it. And the good news? Treating sleep apnea dramatically reduces stroke risk. Now let's talk about insomnia, another sleep disorder that's often brushed off, but may be silently damaging your brain and heart. Insomnia isn't just about lying awake at night. It can take many forms. Difficulty falling asleep, waking up in the middle of the night, waking up too early and not falling back asleep, non-refreshing sleep, even after 7-8 hours in bed. For older adults, insomnia can feel normal. After all, doesn't sleep get lighter with age? Yes, but there's a tipping point where it becomes harmful. Here's what the research shows. People over 60 who suffer from chronic insomnia have higher levels of cortisol, the stress hormone that raises blood pressure and damages arteries. They also have less deep sleep, which is essential for cognitive repair and vascular health. In a long-term study tracking over 1,400 seniors, those with chronic insomnia had a 37% higher risk of stroke than those who slept well. And perhaps most concerning, insomnia often goes untreated in older adults. Doctors may prescribe sedatives or sleep aids, which sometimes worsen the problem, especially if they lead to falls, confusion, or dependency. So what's the solution? Cognitive behavioral therapy for insomnia, CBT-1, has been shown to be more effective than sleeping pills in older adults. It helps retrain your brain to sleep again safely, naturally, and deeply. Have you ever had the irresistible urge to move your legs at night? Or felt tingling, crawling, or burning sensations that keep you from falling asleep? That could be restless leg syndrome, RLS, another hidden sleep disorder that can rob you of restorative sleep and increase your stroke risk. RLS is more common in seniors and in people with iron deficiency, diabetes, or kidney disease. It often goes undiagnosed, but the result is the same. You lose deep sleep, and that matters. There's also a less-known issue called sleep fragmentation, when your sleep is repeatedly interrupted, even if you don't fully wake up. This can be caused by noise, bathroom trips, chronic pain, anxiety, medications, and the effect? Your body never reaches the deep, healing sleep it needs. Fragmented sleep has been linked to higher blood pressure at night, increased heart rate variability, and you guessed it, a higher risk of stroke. You might be wondering, how do I know if my sleep is putting me at risk? Here are some subtle warning signs, especially if you're over 60. You fall asleep watching television, but lie awake for hours in bed. You wake up more than twice a night. You feel unrefreshed in the morning. You nap frequently during the day. You snore, choke, or gasp at night. 1. You struggle with memory or concentration. You've been told you move your legs a lot in your sleep. Your mood has changed, feeling irritable or down for no reason. If you checked off more than a few of these, your body may be signaling a deeper sleep issue, and it's worth getting checked. Because the earlier you take action, the better your chances of protecting your brain and reducing your risk of stroke. Coming up next, we'll talk about actionable steps you can take, starting tonight, to improve your sleep naturally without medication and strengthen your body's natural protection against stroke. From the best nighttime routines, to the foods that help you sleep, to the overlooked sleep habit that may cut your stroke risk dramatically, you don't want to miss it. So many seniors live with poor sleep, thinking it's just part of growing older. But science is clear. Restorative sleep is possible at any age, and it could be the single most powerful shield you have against stroke. Let's learn how to make it happen. Coming up, sleep protective habits that could save your life. Part 3. Natural sleep strategies to lower stroke risk.